Hello out there in Cyberland. I hope you've all been managing okay and finding those parts of each day to reconnect with people you love and not get too overwhelmed by the craziness of these days. Thanks very much for joining what will be a very important discussion and conversation this afternoon, Friday, May 15th, 2020. As the weeks of our global crisis go on, the thematic formulated today is proving more and more critical and prescient. Staying alive, but also staying alive, some reflections on the pandemic as a portal. The global spread of a microscopic virus places the ravages of racism and inequity under the microscope. But predictably, some commentators are already placing the blame for higher Black mortality from COVID-19 on Black people themselves. In contrast, we situate this data within the broader context of social inequity and the longer history of scientific and medical racism. We also highlight how Black communities are proactively engendering justice, joy, and mutual aid in the midst of crisis, as we always have, as Black people always have. Finally, we encourage deeper reflection on how the pandemic is a portal for creating a new world in which we can all thrive. Joining Professor Ruha Benjamin today will be Professor Nicole Fleetwood, whose new book can speak to the experiences of people who are incarcerated during this crisis, and also Monica McLemore, whose experiences as a professor of nursing offers a perspective from inside the healthcare system. My name is Tchen. I'm the director of the Price Institute at Rutgers in Newark. I'm honored to serve as the Clement A. Price Chair of Public History and Humanities. And I should just say that Clement always embraced and was radically open to making sure that the Newark campus would be one based on social justice. And this beloved community is a place that I'm really honored to work in. Back in February 2020, the Price Institute sponsored our annual Marion T. Wright lecture series. It was our 40th anniversary, and the focus was on Black futures. And that was when we had the honor and privilege of having Dr. Ruha Benjamin electrifying the 400 people in that audience space. So at this moment of crisis, which seems like a long time ago, February seems like eons ago, but it was just a short while ago, we thought that it would be fantastic to have Dr. Benjamin come back and speak to a broader audience about how she is seeing things right now. So we're really delighted that she could be with us. I just want to quote the Arundhati Roy, the great South Asian writer, who formulated this term, the pandemic is a portal. This is a quote. Historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It is a portal. A gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our databanks and dead ideas, our dead rivers and smoky skies behind us, or we can walk through lightly with little luggage, ready to imagine another world and ready to fight for it. I just wanted to also offer a land acknowledgement that Rutgers at Newark is on the land of the Munsee Lenape peoples, north of the Raritan River and encompassing a vast biodiverse estuarial region and waters that we now think of as the New York metropolitan region. I offer this recognition as also a way to acknowledge the taking and despoiling of these same lands and waters, the dispossession process that happened of whole peoples and their way of life that had been living on these lands for thousands of years, and the injustices upon which more injustices that continue to visit the now dispersed Lenape peoples, but also the people who have settled on the land since then. And also to say that all of this is important for us to understand because as the UN IPCC's report about climate change makes clear, thousands of the world's top scientists are really talking about more crises to come unless we dramatically change the ways in which we operate the coal-based economy. So there's a heavy context in which this crisis also sits within. Without any further delay, actually, I do have a couple of comments. I just wanted to say that if you head over to tinyurl.com, tinyurl.com/May 15th book, you can get a chance to win a copy of the incredible book that Dr. Benjamin has written, Race After Technology, Abolitionist Tools for the New Jim Code. There are limited copies available for this giveaway, and we will only be shipping within the continental United States. Sorry, Canada. Sorry, Mexico. Following the conversation, follow the conversation and interact with us through Facebook, Twitter, or Instagram by using hashtag COVID-19 Justice and tagging us at Price Institute and at Price _Institute on Twitter. So without any more delay, I do want to just kind of briefly introduce Dr. Benjamin. Dr. Ruha Benjamin is Associate Professor of African American Studies at Princeton University, founder of the Just Data Lab, and author of People, Science, Bodies, and Rights on the Stem Cell Frontier 2013, and of course the book that I just mentioned, Race After Technology, which was published in 1919, among other publications. Her work also investigates the social dimensions of science, medicine, and technology with a focus on the relationship between innovation and inequality, health and justice, knowledge and power. Without any more delay, it's my pleasure to introduce Dr. Ruha Benjamin.
Thank you. Thank you so much, Professor Tchen, for that introduction, to the entire staff of the Rutgers Price Institute for hosting this event, and a special thanks to my co-panelists, Professor Fleetwood and Professor McLemore, for your incredible work and for taking the time out for this conversation. So about a month ago, I was scrolling through my Twitter feed, and this tweet by Aaron Thomas caught my attention. He said, quote, "I don't feel safe wearing a handkerchief or something else that isn't clearly a protective mask covering my face to the store because I'm a Black man living in this world. I want to stay alive, but I also want to stay alive." For me, this idea, staying alive, but also staying alive, expresses a profound tension, desire, and insight that we are not only trying to survive a viral threat, but also the everyday social threats of a racist society. And the fact that some of us could endanger ourselves by acting in solidarity with everyone else, by wearing a homemade mask to the store, is a symptom of an ailing body politic. A few days ago, I was watching the Netflix documentary, The Great Hack, which I would encourage everyone to check out. There's this moment when the narrator is explaining the goal of those who use fake news to manipulate the electorate on both sides of the Atlantic during the 2016 election and the Brexit vote. The main aim of these disinformation architects is to break society. According to Steve Bannon, for example, quote, "It's only when you break it that you can remodel the pieces into your vision of a new society." Their new vision, of course, is nothing new, just more white supremacy, more class warfare, more patriarchy, more imperialism. And to get more, they need to break, or we should say continue to break, the social contract by deepening divisions and amplifying hierarchies using what might be better called anti-social media. The point being, there are powerful people and organizations working overtime to undermine the very premise of society. What then does it mean to stay alive in a context when there's a deliberate campaign to break the social? For starters, I think it entails a keen understanding that many of the policies and structures that govern our lives are working against the social, pushing a corrosive individualism cloaked in the language of freedom. This was true before the pandemic and has only intensified since. To stay alive, we have to challenge the corrosive individualism that infects every area of our lives. We can and should work against the revolting distortion of freedom talk, which is really just the freedom to go to work without sick leave, the freedom to nurse the ailing without protective equipment, the freedom to grow the nation's food with the looming threat of ICE raids, the freedom to be warehoused in prisons with no way to socially distance, the freedom to be stranded in nursing homes with no way to avoid contagion, the freedom not to care as the most vulnerable die off. The aim of this strain of freedom from mutual obligation, is to break society, to erode mutuality, to grind down our ability to care for one another, to eat away at any notion of a collective good, and to destroy the institutions upon which our society depends. The fact is, ours has never stopped being a eugenically structured society designed for the fittest to flourish and the vulnerable left to die. This destructive ideology was alive and kicking well before the pandemic, and it's being revived now to reconsolidate power and privilege in the wake of this global crisis. So why can't we seem to bury it once and for all? It's tempting to tell a story going back just a few months or a few years in which our federal government made a series of monstrous decisions, from firing the entire pandemic response team in 2018 to the administration's slow and ineffective adoption of public health measures up to the present. But of course, the story goes back much further, hundreds of years, in which our deeply stratified social order is rooted in genocide and slavery. The Indigenous Peoples Movement and Lakota Peoples Law Project reminded us as much in a virtual town hall titled "From Smallpox to COVID-19, Let's Heal One Another," which drew attention to the longer genocidal history of infectious disease, but also to the life-affirming cultural traditions which we can and must build on. To stay alive, we can't bury this history, because racism is productive. Not in the sense of being good, but in the literal capacity of racism to produce things of value to some, even as it wreaks havoc on others. Many of us are still taught to think of racism as an aberration, a glitch, an accident, an isolated incident, a bad apple in the backwoods and outdated, rather than as innovative, systemic, diffuse, an attached incident, the entire orchard, in the ivory tower, forward-looking, even viral. In my field of sociology, we like to say race is socially constructed, but we often fail to state the corollary that racism constructs. In the context of the pandemic, we know who racism is harming, but who is it benefiting? What is it producing? If we only look at the underside, we miss seeing who racism is enriching, whose lives is it extending. The combined effects of racism and capitalism intersect and infect every aspect of this pandemic. Who has access to personal protective equipment? Who's treated with care and dignity when they go to the hospital? Which businesses are receiving bailout? Which students are able to transition to remote learning? Who are police arresting for social distancing violations? For those of us sheltering in place, who's growing and packaging our food? Who's delivering our mail? Who's working in nursing homes? Who's disinfecting public space while the rest of us sleep? Who's keeping public transportation running? Who's picking up our garbage? And who, in other words, is holding society together? Essential but devalued labor. As the poet M. Norbisi Philip put it, if we were truly in this together, we would not be in this together. This reality, however, is not inevitable, rather the outcome of choices that people and institutions make to invest in some things but not others. But together we can and must insist on radically different investments as part of what it means, as part of what it's going to take to stay alive. I should say too that one of the many ways that cycles of dispossession persist is that a growing number of people are willing to acknowledge race, but not racism. In so doing, they'll talk about racial differences of all sorts, but then go on to distort the reason for those differences by pointing to the poor behavior of individuals or the poor values of different cultures. At a recent press conference, for example, the US Surgeon General singled out Blacks and Latinos to urge, quote, no drinking or smoking as a preventative measure during the pandemic, which plays into a long history of government officials invoking the supposedly bad behavior of racialized groups as the reason for their hardship. We see it with the very different responses to Black and white drug use, for example. One is a public health emergency, the other a crime. This, as we know, is textbook distortion, pulled from the culture of poverty playbook, which lets the bad behavior of powerful institutions off the hook. And this distorting lens is not just a top-down phenomenon. It permeates everyday understandings of racial disparities. Teachers use it, employers use it, police use it, even doctors and nurses use it. For example, a friend of mine, Professor Kiara Bridges, was recently on the radio talking about the racial dimensions of the pandemic. And a nurse who had listened to her interview emailed Professor Bridges to say, quote, I believe you have some huge blind spots. I am white, 64, registered nurse who has worked in critical care for 40 years. I dated a Black man from Louisiana, she tells us. I am experienced at being a bedside nurse and interfacing with Blacks in intimate situations. I may have insight that you do not. I take issue with your comment about perhaps Blacks not getting good health care prior to admission to the ICU. You made no mention of whether these patients took responsibility for their own health, in all caps. I believe the Black culture, caps, increases the likelihood of Blacks not being taken care of as well as whites. It is a choice of their own. They damaged themselves before they ever got to the hospital. The nurse's email goes on for several pages, acknowledging health disparities, but blaming it on the poor behavior of individuals and the pathology of Black culture, textbook culture of poverty talk. The point is, two people can look at the same data and interpret it in dramatically different ways. One person narrowing the focus on individual bodies and behaviors, and the other zooming the lens out to include all of the factors that actually lead to illness and premature death. We've all heard or thought some version of this distorting narrative in our personal and professional lives. And so one of the commitments we can all make right now is to not let this slide, because the narrow interpretation is not simply lazy or just another opinion. It's wrong and dangerous. When it comes to the pandemic, for example, we hear a lot of talk about the pre-existing biological conditions that make poor and racialized people more vulnerable to the virus. But we have to be very clear to name the pre-existing social conditions in housing, employment, and healthcare that have impacted communities well before the pandemic. The social ills of our nation, not simply the biological ailments of individuals, are leading to higher rates of Black, Latinx, and Indigenous death so far. So in wrapping up, I've been reflecting on that essay, The Pandemic is Portal, which Professor Tchen quoted at the beginning, where Arundhati Roy writes, historically, pandemics have forced humans to break with the past and imagine their world anew. This one is no different. It's a portal, a gateway between one world and the next. We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our data banks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly, with little baggage, ready to imagine another world and ready to fight for it. To do this, though, we have to reckon honestly with what all we've been carrying with us. Because if we're not careful, we will almost certainly take dead ideas, sometimes disguised as new and enlightened. When we have a more expansive understanding of what's ailing us, we can develop a more transformative approach to healing. Even the fact that some people have a hard time imagining that we can ensure universal health care or create a world without prisons is a reminder that our imagination of what is possible is severely constricted. Imagination is not an ephemeral afterthought that we have the luxury to dismiss or romanticize, but a tool, a resource, a necessary part of staying alive. In fact, we should acknowledge that most people are forced to live inside someone else's imagination. And one of the things we have to come to grips with is how the nightmares that many people are forced to endure are the underside of elite fantasies about efficiency, profit, security, and social control. Racism, among other axes of domination, helps to produce this fragmented imagination, misery for some, monopoly for others. This means that for those of us who want to construct a different social reality, one that's grounded in justice and joy, we can't only critique the underside, the world as it is. We have to work on building the world as it should be. This is what it means to stay alive. That said, I know this is a lot to chew on, as many of us are just trying to get from one day to the next at this point. The more we understand how oppression is perpetuated, the more overwhelming it feels as we each figure out what role, what part we can play. But I want to suggest that precisely because of the many ways that inequity takes shape in our laws and policies, in our norms and practices, institutionally, but also interpersonally, this means that no matter what context we're working in, we can find ways to work against injustice and work for solidarity. In the process, we can draw upon the example and insights of so many people who did the work before us, like the incomparable James Baldwin, who said, "I can't be a pessimist because I'm alive. To be a pessimist means that you have agreed that human life is an academic matter. So I am forced to believe that we can survive whatever we must survive." And like the brilliant Audre Lorde, who wrote in her cancer journals, "I have found that battling despair does not mean closing my eyes to the enormity of the tasks of effecting change, nor ignoring the strength and the barbarity of the forces aligned against us. It means teaching, surviving, and fighting with the most important resource I have, myself, and taking joy in that battle." She goes on to say, "It means for me recognizing the enemy outside and the enemy within, and knowing that my work is part of a continuum of women's work, of reclaiming this earth and our power, and knowing that this work did not begin with my birth, nor will it end with my death." Drawing upon this ancestral wisdom, Baldwin, Lorde, and so many others, every single one of us has a role in envisioning and building a more just and joyful society than the one we currently inhabit. If this virus has taught us anything, it's that something that is invisible can be deadly. This also means that seemingly small things, small decisions we make, small actions we take, can have exponential effects in the other direction, affirming life and invigorating society. And there are myriad ways that people are already doing this, whether we're talking about all of the mutual aid networks working overtime to raise money, deliver groceries, check on neighbors, the gendered care work that holds our society together, and those advocating for the release of prisoners who are especially vulnerable at this time, or those workers organizing in warehouses, grocery stores, farms, and the gig economy. And of course, all the artists and musicians who are hosting live virtual sessions, helping us feel our interconnection with one another at an embodied level. Finally, in terms of public policy, there are many things that we have to do and must advocate for and demand. One initiative I'll encourage everyone to check out is called the People's Pandemic Prevention Plan, which is demanding immediate and long-term structural change, including $75 billion to set up a community care corps, to hire hundreds of thousands of out-of-work people to take on the work of ending the COVID-19 pandemic and protecting against future outbreaks. We're gonna add a link to this initiative in the live feed, or you can just look up the People's Pandemic Prevention Plan on the Action Network website. All of these ways and more is how we stay alive. With that, I'm now gonna turn it over to my co-panelists, and we're gonna engage in a little conversation. Thank you so much for your attention.
Thank you so much. It was amazing, fantastic. Let me introduce the two co-panelists. Monica McLemore is at the University of California, San Francisco. Monica is an associate professor in the Family Healthcare and Nursing Department and an affiliated scientist with Advancing New Standards in Reproductive Health and a member of the Bixby Center for Global Reproductive Health. She retired from clinical practice as a public health and staff nurse after 28 years of clinical nursing work. Her program of research is focused on understanding reproductive health and justice. Nicole Fleetwood is a writer, curator, and professor of American Studies and Art History at Rutgers University, New Brunswick. Her books are Making Time, Art in the Age of Mass Incarceration, 2020. Just came out. Thank you so much. I'm looking forward to it. And on Racial Icons, Blackness and the Public Imagination, 2015, and Troubling Vision, Performance, Visuality, and Blackness in 2011. She is co-author of Aperture Magazine's Prison Nation, a special issue focusing on photography's role in documenting mass incarceration, and co-curator of Aperture's touring exhibition of the same name. Welcome to you both.
Thank you.
Thank you so much for having us. Thank you. I first of all, I want to shout out the housekeepers, nurses, physicians, cafeteria workers, medical assistants, doulas, anybody who's an essential worker right now. We see you. We love you. We are very grateful for the work that you're doing. And can we please stop participating in war metaphors about what you're doing? Because it's just, if we approach everything from war metaphor, then everything looks like a fight. And quite frankly, I'm really done with that. And I want the rest of us to be done with that too. Ruha, you know, I could listen to you talk all day, and I'm so grateful to get a chance to be in conversation with both of you who do such incredible work. I will say, and this is for any other clinicians who are retired, I did put in an application to rejoin the public health workforce as part of the COVID recovery response, because I think it's super important that we actually could use this portal as a way to rebuild the public health workforce. That's a conversation I'd really like to be able to have. Yes, we've seen laid to bear the failed public health response. We are currently seeing the discrediting of scholars and healthcare clinicians and epidemiologists and fact-based individuals who really, really want to be able to, you know, help us move through this pandemic. And at the same time, we have people yelling and screaming about reopening economies, re-exposing folks when we actually don't have any real tools to protect people. And I think that the revitalization of the public health workforce, as well as the ethics of public health, we need to remind the public about that, because they're different than the individualism that you talked about. They're different than, you know, I'm going to survive and the collective good is not, and I actually really don't care. It's really different than saying, oh, we're gonna let the elderly die for the economy. right? Public health ethics requires that we look at the situation of circumstance and the social determinants of health, and the people who are already not capable of being able to optimize their health because of structural racism and institutional racism that existed prior to a pandemic. In my own field, I mean, I'll tell you, we had a Black maternal health crisis before all of this happened. We knew from the Centers for Disease Control and Prevention that Black women were 3 to 4 times more likely to die from childbirth and pregnancy and postpartum complications. We already knew that. For me right now, it's more about how do we mitigate harm? How do we think about, getting through this and rebuilding, making this all different? Where do we get to the call for action and the challenge to say, hey, everybody, we had 80,000 deaths this week. Let me remind people, we've been in shelter in place for 8 weeks, right? 80,000 deaths. And perhaps maybe because we've been at war, in the Middle East and Afghanistan and not seeing those bodies coming back, we actually don't have an understanding of what the scale of death is that we've seen in 8 weeks, even though we've been at war for 19 years. Like that scale, I'm old enough, I came up during the HIV crisis. I started my nursing school degree in 1988 in New Jersey. And the funny thing about the arts and why we need them so much is the AIDS quilt really brought a visual representation to people about that generation of people that we lost. And so at some point, my call to action here is we need a Live Aid, a Farm Aid. We need some kind of public acknowledgement for the generation of people that we've lost in 8 weeks. We need to remember them. We need to honor them. We need to know who they were. And so I hope, part of my call to action and the challenge is that we acknowledge that hurt. But I also want to shout out Club Quarantine and that we continue to create and we continue to thrive and we continue to think about playing, because if we're going to have a pandemic, I don't want to be in, or if we're going to have a pandemic as a portal, I don't want to come through this and go back to where we were. It's not a loop. I actually want some of the things that, at least in healthcare, that we've seen make happen that we wanted to see for years, I want that to stay permanent. The reason you see a staff where I'm at could send a whole team of people to New York City is we relaxed the rules. Even though we've had national licensure for years for nurses and physicians, we relaxed the rules that you could work across state lines. How about we make that permanent? Or how about the fact that, the major payer for healthcare, Medicare and Medicaid, historically wouldn't pay for telehealth. And all of a sudden, pandemic hits and we have payment for telehealth. Why don't we make that permanent too, right? So as we continue our discussion, our conversation, let's honor what we've lost, but then let's challenge ourselves and let's have a call to action to how this could have been different. Nicole, I want to hear about your work in incarceration because we love your work. We started a doula program in carceral settings so that we could not just support pregnant people in jails, but we could also train them as birth doulas so that when they came out, they could actually support other people and be community resources. So one of the reasons I love your work, and we followed it for a long time, is engaging with carcerally involved folks. We could have unleashed a whole other public health workforce if we actually would have focused on formerly incarcerated individuals.
Thank you so much, both of you, Ruha and Monica. I'm so happy to be here. And thank you also, Jack, for the generous introductions. I'm quite overwhelmed. I mean, there's just so much that has been said in the little bit of time we've had together. There's a few points and I also want to say that so much of the important work that's happening right now around prisons and the COVID crisis in prisons really are led by directly impacted people. And so I want to shout out to all the people who are doing the work and who are risking exposure to do that work. I've been on some online events with like Mary Baxter, Asia Johnson, Michelle Jones, all Black women, all formerly incarcerated women, incredible feminists who are all working hard to get people released from jails and prisons, and in some ways putting themselves at risk by doing that kind of work, spending hours at facilities trying to get people out, bailing people out.
through the National Bailout Project, Free Black Mamas, and the like. And I also want to say this evening at 8 p.m., I'm participating in a fundraiser through Die Jim Crow. Die Jim Crow is a really important nonprofit that does art-based programs in prisons in the U.S., including sound projects. And they're doing a fundraiser because they've been sending PPE into prisons. They've been able to successfully get PPE into prisons in Ohio and Mississippi. And so I ask people, it'll be on Die Jim Crow's Facebook event at 8 p.m. So I ask you to join in and contribute whatever you can contribute. All proceeds will go to PPE for incarcerated people. And, you know, I'm glad, Ruha, that we get to continue this conversation that we started, or maybe we've been having, you know, for longer than we know, right? Because but that we were able to engage in on Wednesday. And thank you for your generous, you know, comments about my work. But there's something that just really struck me, and that is so productive. And it's more of a question to you. It's about how you're talking about racism as productive, right? That we often talk about it, right, as something that is nihilistic or something. We talk about it as if it will just defeat itself because it's so corrosive, right? That it will ultimately fall flat and become outdated. But racism, like carcerality, is nimble, it's expansive, it knows how to morph, you know, it knows how to lead the public as it morphs. So you think you're getting something else, right? And I'm thinking about like now digital jails, right? So now even when people are being released from jails, a couple of people in my book, they got released and they're on parole for the rest of their lives. And they have to wear ankle monitors and they pay for those ankle monitors, right? So even in freedom, right, that the structures of carcerality actually become more robust and profitable, right? And to me, that is, we know carcerality is racism too, right? Like it's racial capitalism. So I know I'm supposed to be talking a lot, but I really want to engage with the idea of racism as productive, because I just thought it was such a rich way for us to think, to just be more vigilant about what we're seeing, you know, because it's easy to dismiss Trump supporters as outdated, right? But actually there's a whole ideology that has morphed and in many ways they're ahead of us in terms of like, they knew they were going to show up in Michigan militia style at the Capitol.
Yep.
Right? Like, so there's ways that I think that if we make it smaller than what it is, then we're always going to be behind it.
You know, I want to build on that because, you know, for me, the point that really stuck with me was really the story about the nurse, right? And so one of the things that I think we need to connect for people is the militia folks who showed up with the guns at the the city hall, that everybody wants to make that like a bad and visual and hierarchical thing. And yet the same misperceptions, the same inaccurate information, the same inability for a nurse to be able to not connect the structural factors that are associated with health outcomes. To me, in my mind, there is no hierarchy of racism, right? You're really bad if you have Confederate flags and you got guns, but somehow you're okay, like if you perpetuate or think, inaccurate or incorrect stereotypes about people, but you're a healthcare provider that's supposed to serve the public. Right.
And I would say that the second version you described, I wouldn't put it on a hierarchy, but I would say there's something even more pernicious and dangerous about the fact that here you have someone who's been at people's bedside for 40 years. This is the place where you put your loved one in their hands. So I can avoid the militias. I can drive around. I can drive around the Capitol. Right? But here you have in all of our, and I think about it both in terms of nurses at the bedside. I think about it, the fact that so many teachers who we put our children in their care also hold this disdain for Black children. Imagine giving your child to be in a context for the majority of their day with adults who actually do not like them and think so little of them. To me, there's something much more pernicious about the do-gooding professions in which this racism is viral, much more so than the people coming at me with the bazooka.
Yeah, I completely agree. And then how that's normalized and codified in the structures so that they can't even see it, right? I'll give you a perfect example from my own, lived experience of COVID-19 and the pandemic, right? Normally, I'm a highly productive scholar. I do a lot of work. Yay, that's all great. Why have I written 3 grants in the last 2 weeks during a pandemic, right? Why do funders and scientists and scholars and other people think that that is okay, right? Where we need to get money in the hands of community. We need to mitigate harm, right? From a viral agent, but yet you still think that the only way to be able to ensure for us to ethically be able to do it, you somehow have been convinced, right? This is what I mean by this challenge, this call to action, why this could have all been different. This whole notion that because you think you're doing good in the world or you think you're a caregiver, somehow, it exemplifies you from the hard structural, personal, professional work that you need to be doing to dismantle racism and to dismantle gender oppression and to dismantle, patriarchy isn't part of the work that you need to be doing. Is a real problem.
Yeah, and I think about, how when we put it when it's framed as dismantling or, thinking about what it means to act on our anti-racism, right? And it can seem like such a grand, big gestures, big things, big movements, which are all important. But part of what, I think is important for those listening to realize that the reason why we are where we are today isn't because simply of big, huge policy shifts. It's also in the very invisible ways that these things are perpetuated out of sight, behind closed doors. And precisely because the status quo is perpetuated in the kind of microphysics of racism and inequality, that means that these little things that we ourselves are complicit in, we have to begin to address. And so one of the things we've been all talking about is, even just the stories we tell ourselves and that we tell people in our circles about why things are the way that they are. Stories in this sense are very powerful in terms of perpetuating. So it's not just we have to deal with doing the big things out there, but we all have to take stock of the stories, the narrative power that justifies and that explains wrongly why things are the way that they are.
And then perfect example, do you all listen to Cuomo do his daily updates? So what's happening now with his daily update is he is explaining why the new cases. And he said the new cases are happening in homes. We know those homes are occupied largely by Black and Latinx people in New York City. And he said, so it's being brought into their homes basically by a loved one. And he said, we can't control that because we can't control behavior. Again, this is blaming people of color for pandemics, right? Or for communicable diseases. And at no point did he acknowledge the fact that 75% of essential workers in New York City are people of color. So these are people who are being exposed to keep the city running. And they're going, and we also know the history of housing for people of color, especially for Black people. So the hot spots now, are the zip codes where NYCHA housing is, are the housing projects. Those are the large, that's where in the last week, as the numbers have gone down significantly in the city in New York, I live in Harlem, they have not gone down around NYCHA, the zip codes of NYCHA housing. And the governor's explanation is it's behavioral. And that people are now acquiring it in their homes. And the next step, the next logic is let's reopen the beaches.
Mm-hmm.
Right? So like we can live with this group of people being exposed and, you know, most likely dying or getting, because we have it contained to those spaces.
Or,
right?
I mean,
in their homes.
Yeah, or, you know, on the West Coast, we have a situation where, yeah, it's great that we flattened our curve, but we flattened it on the backs of Latinx people in the Mission District, right? We see in San Francisco, it's great that we've been able to keep our numbers of cases down and that we've been able to really be able to think about opening back up again. But the truth of the matter is that curve was flattened on the back of essential workers, especially people who, and I know this is probably a problem and an issue in New York City, where rents are so high, you have multiple people living in, you know, cramped spaces where social distancing at home is not a thing, or self-quarantine at home is not a thing. And yet people want to blame poor people for being impoverished, right? As opposed to really saying, you know, as a nurse, we got to take advantage of the fact that, you know, many hotels allowed for us to be able to self-quarantine without charge. But again, that structural issue of you had to present a hospital badge or a nursing license. Why didn't we just like ask our hotel friends to say, y'all, we're in a pandemic, whoever needs to quarantine, right? Can you help us out? We are all in this together. But when you spent decades discrediting the federal government and its role to the citizens, when you spent, you know, decades, you know, thinking that individuals are the only people that matter, you made corporations persons, then you don't have a situation where we can have a collective response that is dignified so that we can all get out of this.
Yeah.
And you have no regard for the person who is the grocery worker. You just want them to do their job, right? Exactly. Like, it's not about, you know, even this, like, let's praise essential workers, you know, because as you just said, Monica, if we really cared about essential workers, they would have hotels and rooms, and they would be able to, you know, there's all kinds of ways that we could protect people who are doing that essential work, right?
Right.
But extractive capitalism wants their labor. It doesn't care about their disposability is part of what gets reproduced.
Yeah.
Excuse me, I'm going to need to break in because there's an outpouring of comments online, and I want to make sure that some of them get a chance to get their word in. So let me read a few of them that are kind of related. So, of course, this point about the front line is also a war metaphor, but it's also a metaphor for really the way contestation happens in everyday life, right? So one of the comments is from James Howe. Since Black and Latino folk are being policed more intensely due to COVID-19, there will be post-COVID-19 Blacks and Latinos with more deadly interactions with the carceral judicial system. This is horrible.
And James Hoff is one of the artists in my book. He's amazing. So shout out to James.
Great. And then Jaja Shakur says, we cannot escape war terminology when dealing with the corona pandemic, when you have the leader of the greatest warmongering empire in the world using war terminology and isolating marginalized communities and communities of color with draconian third world health policies in his communication towards health disparities. This is war, and it must be addressed as war. And Shanita Carter says, I had the same question, fighting for life, fighting for protective gear, fighting against protesters at hospitals, in certain states, fighting for sanity.
Well, again, if a pandemic is a portal, I just don't understand why we can't why can't we unleash the creativity of all of us to figure out a different metaphor that actually could work? See, for me, this is the other thing. It's just like when I wrote the piece of Scientific American around not allowing birthing people to have accompaniment when they were when birthing people come to the hospitals to be able to bring new humans into the world during a pandemic. You want their first experience to be separation from the people who helped create that. Like, I'm just so done with everybody who can't. We have to have a group of people. If everybody's dismantling, then who's building? We need a group of people that can actually think differently about all of this. This is a both and, y'all. It's not an either or and only. Can we please have some people that can think differently about this stuff and be able to teach the rest of us? Isn't that the way we function as humans? or am I confused and in the wrong planet?
This
Maybe I
idea-
am. But
I love how you're using the pandemic as a portal, and I brought that up and cited you and Roy recently. But it's a portal that can get used all kinds of ways, right?
Yes.
And right now we're seeing that portal get instrumentalized for more autocratic
Yes.
ways, asking us basically to accept a surveillance state, right?
Yes. Yeah.
I mean, without much careful thought about like what it means, we know that we're also in a moment of health crisis. I'm not making that light at all, but all of the solutions coming from Democrats or Republicans are carceral solutions.
Yeah.
About more surveillance, of citing people with, the poor people who cannot socially distance are the ones who are then going to death machines, being taken to Rikers, or given, $1,000 fine, right? So like all of the solutions are carceral solutions, right?
Yep.
So I mean, that for me is something I just want. When we say the pandemic is a portal, it's a portal to all. That portal can get.
It's not inevitable that it will take us to a better future or a more just future. And so that point, I think we should keep at the forefront that many people are trying to manipulate this time and use this time for different things. Jack, did you have a few more comments for us or questions, or was that it?
No, we have many more.
Okay.
So let me just pick out a few. But let me throw into the pile something that I've always been concerned about, is that we can all unite within this country and agree that a new yellow peril is coming, right? So that there are many layers of assets. And war, of course, is driven by so much of that in terms of who that enemy that we can all unite against will be.
Absolutely.
Right?
Absolutely.
But at the same time, I also think that's, it's not exclusively a characteristic that's attributable to the United States, but people around the world have dealt with pandemics and disaster preparedness and a whole variety of other things. To the arrogance that we have no lesson to learn about how to do this differently outside of a war metaphor, I reject that.
Absolutely. My colleague, Zainab Tufekci, wrote a wonderful piece, I think it was yesterday, in The Atlantic, about how the protest movement in Hong Kong has, in a mercurial fashion, now directed itself at a civic approach, a bottom-up approach to containing the pandemic. And it is not attributable to a good functioning government, but it's how protest in this way is using this time to now redirect and help the most vulnerable and to keep the situation under control. And so that's just one of many places where we should be quiet, sit down and study how other people are approaching it.
Or even with countries in Africa, and all the projections that, Africa is like, there's only 10 ventilator machines and equipment. And of course we know equipment is necessary, but I've heard people who study Africa and public health say that many nations in Africa have dealt quite successfully with pandemics, Ebola, with highly communicable diseases, AIDS, and the like, and with limited resources,
Absolutely.
Right? Like, it's not again, capitalist and carceral logics are not the solution because what we're doing right now, and I think other people also think of social distancing in ways that's still about being together or like civic engagement, right? But that it gets circulated in the U.S. It's through hostility, right? It's a kind of hostile way of engaging with society and the public.
Yeah.
Let me add in a comment by Geraldine Williams. I struggle with the framing of essential workers as heroes and the performative gratitude that's been happening. A lot of folks are working because they have to and are being put in harm's way without true support or safety. It feels like we're martyring folks. What are your thoughts about this?
Absolutely. I think a lot of the rhetoric is giving a symbolic wage through this language of heroism without giving an actual wage, livable wage, much less the kind of option to stay home and the protection that's required for those who do go. So I definitely think that as the as it was put, the kind of performativity of and the lauding. I mean, but we have a long tradition of this, don't we? Mother's Day.
Yep. Yep. Yep.
The way that we give lip service to veterans, right?
Exactly.
And yet the actual policies and structures that are constantly working against that rhetoric. And so what we're seeing now in terms of essential workers plays into a long tradition of giving lip service to people who we want to exploit, romanticizing, creating a heroism around it without actually treating them with dignity.
Mm-hmm. Yeah, I completely agree.
Mimi Nile says, and that the body of knowledge that grounds the training of teachers, nurses, physicians, lawyers is fully rooted in these gendered racisms.
Oh yeah, Mimi Niles is a midwife in New York City, and Mimi Niles works for the public health system there. And thank you, Mimi, for saying that, because you're right. But again, how are we going to transform how we train the future workforce? Actually, we need to even think about who we even conceptualize as the future healthcare workforce. Because here's a dirty little secret that needs to come out. The people we serve are quite qualified to be the future healthcare workforce, and the public health folks to really be able to help us with, contact tracing and being able, that could be a community generated thing that wouldn't have to be part of a surveillance state. Right. But we need people to think differently about that and not just go to tech.
Right. And so this gendered, this is going back to also this kind of lauding essential workers. There was a New York Times, which we know is not like a radical newspaper at all, just a couple of weeks ago, that like in the city, like I said, essential workers, 75% are people of color. Well, Black women are the highest, make up that category at the highest percentage.
Yep.
City.
Yep.
Black women are disproportionately impacted by, this pandemic, if you think about who's on the front line.
Yeah.
Absolutely. And going back to Mimi's, comment, I think that in part explains why the four of us, why we're educators, right? And why a kind of ground zero for seeding a different conception and a different sort of reality is in the very pedagogy, in the very, curricula, in how we think about expertise and knowledge. And so certainly many of the things that we're witnessing and critiquing are the downstream effect of very outmoded ways of thinking about what is health. What are the, so we look at medical school curricula. We look at I spend a lot of time looking at the way that the tech workforce is trained, and how so many of the things we experience as discriminatory forms of design and products, we can trace back to the training ground. And so those people, and in many ways, even we need to explode the very idea of who is an educator. It's not just people with degrees or people who work in formal institutions. This goes back to the call to action that all of us have a role to play in terms of re-educating ourselves and those around us in terms of what we're observing. And so we shouldn't be limited by the titles or the tag on the door. We need to all understand that we have a responsibility to question, and then to also think about what kind of world we want to engender.
Wow, this hour just flew by. We have to wrap up. Monica McLemore, Nicole Fleetwood, Ruha Benjamin, this has been a very important discussion. We will get it out there and distribute it. Lots of people have really made fantastic comments complimenting this discussion. Let me just wrap up with a few quick comments. Thank you all, speakers, viewers, and for joining us. The Price Institute works to keep the shared public commons justly inclusive and public-minded and public acting. Please stay tuned for future Pandemic as Portal online events through our website or social media accounts. We hope to see everyone in person soon. And let me just quickly thank the amazing Rutgers University Newark community. It's a wonderful place to live and work. And thanks for the Price Institute staff. Today, especially Jessica Hernandez and Claudia Sepulveda really did the heavy lifting, and also Maureen Mien, Shalamisha Tillett, and Mark Krasovic, and Alexander Cheng. Thank you all. Thank you so much. This was fantastic. This will be posted, and please go check out Professor Ruha Benjamin's book, and also everybody else's work and their links that we have online. Thank you so much. It was really wonderful.
Thank you.
Thank you.
Bye.